Good afternoon. So, today we're going to be going through the cardiovascular system. So, on the venous side, there are some different disorders that we can see. First one, varicose veins. We'll look at that. These are tortuous veins is what they're called. Basically, the walls of the vein have failed. Chronic venous insufficiency, the problem here, valve failure. So arterial blood is high pressure. Venous is very low pressure. And so we rely on like muscle milking, these valves as an elevator system, especially through like our legs, to return blood to the heart. If there is obstructions, so thrombi, emboli, so thrombi, are like a deep vein thrombosis. It's stuck in the vein. If it breaks free, that's an embolus, okay, and it'll lodge somewhere else. And then superior vena cava syndrome, there is an obstruction of the superior vena cava. So it's pretty interesting when they lay down, because gravity isn't there to help them with drainage. When they wake up in the morning, their face is very puffy. And then as they stand up and gravity helps, it helps drain it past that blockage. Okay? So varicose veins, these little tortuous guys right here, lots of causations, right? Increased viscosity of blood, standing all day, weight gain, plasma gain, so like pregnancy is a big causation. And then just genetics. If one of your parents had it for no reason, you probably are going to end up with them. Okay? And the chronic venous insufficiency over time is just this valve failure. And so you can get more edema down here. These hurt. They can be treated. I think right now they can do laser and like zap them. They're superficial veins. It's not of a concern. And then I believe they inject them with something and it reduces them. Basically, you block it further down so blood doesn't even try and travel through there. Virchow's, so we talked about this. Remember the three: hypercoagulability, stasis, and damaged epithelium increase the chance of forming those clots. That's a big old clot right there. Emboli, this is when a clot breaks. A thrombus breaks off a piece and it travels. So typically they're on the venous side. They go to the heart, then they go to the lungs. Because there are small vessels there, they get trapped there. Okay, so that's how you end up with like pulmonary embolisms. Can it happen on the arterial side? Yes. Typically you talk about this with like AFib. Because the atria is fibrillating, okay, not in sync with the ventricles, there's stasis of blood. A clot forms and then it goes somewhere. It can go up, stroke, or it can go down, and typically where it gets caught is the superior mesenteric artery. That's the most common spot. And when it goes there, that's what feeds the transverse colon. And they can have basically an infarct of the colon. Of that portion of the colon, it has to be removed or resected. Arterial disorders, so lots of different things here. A big one that you're going to see is hypertension. That's just very common. As we age, some of us will just develop it regardless of diet, exercise. But the big causation is diet, okay? Lack of exercise. Aneurysms, these can be full aneurysms where it is a rupture. Sometimes it can just be a bubbling out due to a failure in the arterial wall. Raynaud's phenomena, so this can damage the vessels as well. That's a autoimmune disease. Thromboangiitis obliterans or Berger's disease. This is commonly seen with smokers. We'll look at that. Arteriosclerosis, this is just artery disease over time, hardening of the arteries due to plaque buildups. Okay, don't know why I have Berger's again on here, but yeah, related to smoking. Okay, so hypertension, lots of causations here. For us here in the US, really you're going to say atherosclerosis and diabetes. These are the big causations. Beyond that, so something to think about this. You have a fixed volume of fluid in your body, okay? Blood. So let's say 5 liters. I have the capacity for 5 liters. If I tighten the compartment, the pressure increases. I still have 5 liters in there, but now I'm squeezing it. That's increasing the pressure. So there's like stress, okay? Stress. Or I add more volume, so more cardiac output, or I increase volume intake somehow, or I can't get rid of volume. All of these will increase it. Okay, so here's your hypervolemia, renal artery stenosis. They can't filter out their blood properly. They're not generating urine like they should. Kidney failure, hyperaldosteronism. You're holding on to salt, so you're holding on to water. Okay, hypersecretion of ADH, not getting rid of water. Aortic coarctation. So what happens is on the aorta coming off the heart, main vessel coming off the heart, it's got a pinch down area. It can happen, you can be born with it, or you can develop it at an older age. And so what happens is the carotid arteries, for example, have baroreceptors in it. They're not seeing the pressure they should, so it triggers the body to increase volume, increase cardiac output. And so you can see increase there. Pregnancy, they increase plasma about a third or 30% compared to normal. Okay, and then pheochromocytoma. It's all those catecholamines. Okay, on both sides. There, that's all adipose tissue here. Okay, that's fat surrounding it. So, like I said, all of these can develop, including chest pain. Okay, angina pectoris. Including chest pain there, right? So dealing with hypertension is very important. When people have high blood pressure, it needs to be addressed. Sometimes they talk about hypertension as the silent killer because a lot of people don't realize they have it. So aneurysms, so true aneurysms, you go through all tunics, you rip completely. Majority end up being dissections, and then eventually that can fail, okay? If it does fail, then it becomes true aneurysm. A lot of times these are seen in the abdominal aorta. And so this is the abdominal aorta aneurysm, or the AAA. Depending on the size, it needs to be dealt with. And what they can do is basically put in a stent. And so it's like a tunnel inside your vessel to allow the blood to travel through there and not apply the pressure to that weakened area. And it really depends. These happen in elderly people. They'll lay down and you'll see their abdomen just pulsating. That can be a sign. Depending on the size, age of the patient, sometimes they don't treat these. It's too risky. It's just not worth it. And as long as they control the blood pressure, they can live with it. Okay. Raynaud's. So Raynaud's it's a pretty neat one. It's a vasospasm. So what happens, especially with cold, is a big trigger. They will basically tighten down all these vessels, and you'll see this blue, whitish coloring of the hands. It's painful. It can be numb. So they can take vessel relaxing drugs to help with this. So that like calcium channel blockers, for example, to help relax those vessels. And then they're just recommending, wear gloves, stuff like that when you're out and about in the cold. Thromboangiitis obliterans, or Berger's disease. This is a neat one also. So it's related to smoking. And it damages the arteries. And as it damages the arteries, you get thrombi. As you get thrombi, you get ischemia. So the tissue's just not getting oxygen. And usually they complain about what's called claudication of the leg. They'll be walking and they get pain in their thighs. That's usually a sign. I mean, look at this guy's fingers. This is wild, and he's still smoking. Sometimes smokers just refuse to stop no matter how much you educate them. As a healthcare professional, it is your job every time you see a patient, and they are a smoker, that you try and get them to stop. Okay, you never know when you're going to get through to that patient. All right, there's lots of options out there. I mean, vaping now, for example, that is the proper use for vaping, is to get a smoker to stop. It's a way to step down. Nicotine patches, there's Chantix, there's a lot of different ways to get them to stop. All right, so endothelial injury, here we're talking about high cholesterol. So that LDL comes in, it oxidizes the tissue, it damages it, macrophages migrate in, that continues to create this damage, and we get this fatty streak. As that fatty streak builds up and the collagen is damaged, we now get platelet adherence, and eventually we create that plaque. This starts when you're a child, okay? This isn't in your 40s when it begins. It starts when you start eating regular adult food. So it is important, diet very early on does matter, okay? Atherosclerosis, so this is hardening of the arteries. Like, this is a real artery right here, and you can see, I mean, it's so occluded. There's barely any openings. And that's probably just there because when they were making the slide, to be honest, as they shaved it down, that was probably completely occluded. So it's that whole process that we just talked about, and we get ischemia. And when there's ischemia to the heart, that's your angina pectoris, okay? That's that chest pain that they get. And the reason being, as they work out or walk or something, and the heart needs more oxygen because of the demand of the body, it's speeding up, and it's not getting oxygen, you get pain, okay? So typically what they do is they go in there, they drill it out essentially, and then they put a stent in. Metabolic syndrome, we've looked at this. Make sure you guys know these values. Very common here in the US, once again. It's kind of the trifecta: diabetes, high blood pressure, high cholesterol. Okay? This is compounding. When you have more than one of these, your chance of cardiovascular risk or damage, stroke event skyrockets. Okay? So that's why they get very aggressive when people have diabetes. They get very aggressive on lowering LDL, lowering blood pressure. It's different than just average Joe. If I just went in and all I had was high blood pressure, my goal of lowering would be different than if I had diabetes and high blood pressure. The goal for my pressure would be even lower. Peripheral artery disease. So once again, this is just obstruction of vessels further out. High LDL, that's just the big factor there. High HDL is great. It offsets it. So women, and I always like asking this question when we're in class and ask for people to raise their hands, but I want you guys to think about it at home. How many of you know a male that's had a heart attack? Everyone, okay? How many of you know a female that's had a heart attack? Probably not a lot of you. If the female had a heart attack, there is some genetic component that's wrong, an insane diet, morbidly obese, or they had a total hysterectomy very early on and are not doing hormone replacement. It's pretty rare for a woman to have a heart attack. The reason being, estrogen stimulates the liver, they produce more HDL, it offsets the LDL. Okay? So that's a big reason. Aspirin now, they used to say, oh, take a baby aspirin as a preventative measure. That changed recently, the guidelines, to where they don't recommend it, the risk versus benefit kind of thing. So they're better off, they put you on a statin, or if you need an anticoagulant, we just go straight to that, or Plavix, for example. It's much more efficient and less bleed risk, compounded for no reason with aspirin. Statins, so this is like your Lipitor, Crestor. These are great drugs, okay? And, they work for a lot of people. I personally have familial hypercholesteremia. My LDL is astronomical. It started when I was 18. It's not diet related. I mean, I've had doctors say there's no way your numbers are due to diet, because if they were, I'd be 400 pounds kind of situation. It's genetics. Okay. So for me, I tried statins several times, 3 times maybe 4 actually. And what it came down to was I always had an odd reaction, like muscle pain, which potentially means it's attacking my muscle, and that's very dangerous. You go into rhabdomyolysis, it destroys your kidneys. So I had to be pulled off of it and switched. And then when the next time I went on it, I was having brain fog. I mean, I forgot, for example, my wife and I went to the gym one day. We used to live right next to the gym. For some reason, we were out, I guess, something, running an errand before, and so I drove us there. We walk out of the gym, and I start walking home. My wife's like, "Where are you going?" I was like, "Home." She's like, "But we drove here." I was like, "No, we didn't." I couldn't remember I drove. Okay. And then the next time, the third one, I had with that one, it was attacking my liver, and it wasn't getting my numbers down. So I think initially my LDL was like 230 something. And then with that one, it was down to like 130, and the goal is now is under 70 is the goal. It used to be under 100. And so my doctor pulled me off of that and put me on this PCSK9 inhibitor. These guys are wonder drugs. So I've been on both because insurance, what they want to cover, and it was just wonky. Okay. So I initially was on Praluent. Now I'm on Repatha. They both work very, very efficiently. They are injections. So these are monoclonal antibodies, MABs, okay, monoclonal antibodies. And so I inject every 2 weeks, and I went in and my LDL was 67, I think, or 68. Just hilariously good. Okay. So no other side effects. No, don't need to sit and do liver tests. Nothing. Much safer drug. Yeah, it's an injection, but it's a little pen. You'll just jab it in your thigh and move on with your life. Eat all the steak I want. So coronary artery disease, the warning signs are angina. So there's stable angina. This is like when they work out, they get a spasm. Prinzmental angina vasospastic. This is actually kind of similar to Raynaud's. It just spasms and they get pain for no reason. This is, just a calcium channel blocker, can relax the vessels and they stop having an issue. Silent angina, there's just no pain, but we can see it on like EKG, for example. And then unstable angina. This is really, really bad. This is they're sitting on the couch and they just suddenly get chest pain randomly. Okay. It doesn't take long for myocardial cells to die. They need oxygen like crazy. So that's why, if someone goes down, CPR, starting CPR, even if you don't know what you're doing, find the chest bone and start pushing as hard as you can, okay? Makes a huge difference. And even now they changed guidelines. You don't even have to get breaths. You have someone call EMS and start just pushing on their chest, and you'd be surprised at the difference that can make. Okay? The body is in such a low oxygen demand state, the rest of it, that the oxygen that's already in the bloodstream is kind of sufficient for a period of time. All right? Troponin is a marker that is checked to see if there's been cell death. It's released from the cells, and so that's how we can identify someone's had a heart attack. So they do a bedside troponin now. It's just a little finger prick, and they can test for it real quick. So EKGs help us identify, abnormalities with the heart, and what it is it's a deflection of energy. So the electricity should be going through this pathway. If there's dead cells, it can't go through there, and so it goes around. It tries to go around, and that's why we see these deflections. So ST elevation, so this is STEMI, ST elevated MI, and so the ST segment starts to go up, okay? Non-ST elevation, this can sometimes be seen with angina, post heart attack, and depending on where the heart attack is, and we can see that as well, okay? So that's non-STEMI. And then, like I said, enzymes. Troponin now is the one that they test. CKMB is the older one. It takes a while to rise, and the problem with it is that if someone's like been in a car accident, for example, and they've like smacked muscle pretty hard, you can see CKMB go up, and so it can give this like false positive for an MI. So heart wall. There's 3 layers: pericardium, myocardium, endocardium. So peri is on the outside, myo is the muscle, endo is on the inside that blood is touching as it flows through. So a bunch of different things that can happen here, and we're going to run through them, okay? So first up, pericarditis. So this is fibrous pericarditis. Typically, it can happen after MI. It can happen after certain infections, like an autoimmune response. And we can start to see some abnormalities as well. So if someone has a rupture in the heart wall, they've had a heart attack. After a heart attack, you need to remodel the muscle and replace it with collagen. Well, there's a period like 2 weeks where it's soft and it can just free wall rupture. And if that happens, the blood shifts into the sac here, and that's cardiac tamponade. So with cardiac tamponade, the heart is being compressed. Every time blood gets out there, it's being compressed. There's the pericardium. Look at that. Okay? So you can see this gap, that's fluid. It compresses it to the point where EDV, end diastolic volume, is reduced, and systolic volume is reduced because you can't get blood in there. It's just slowly squishing it. It has to be drained. That's really the only thing. That's where they stick a needle basically into that sac and draw the blood out. Cardiomyopathies, there's a lot out there. Hypertrophic is one of the more common ones. That's the reason you have to get a physical before playing sports. This is like, the athlete that just suddenly drops. There are obstructions, blood flow is not appropriate, and so we can hear typically a little murmur in there, and that can be a way to identify it. Dilated, this is kind of like congestive heart failure, usually older people. And then restrictive, this is like a fibrosis. So here, showing you like the dilated, how large it is compared to normal. Okay? And then hypertrophic, it's an overgrowth, and so it starts to obstruct even like the outlet of the aorta. The ventricles are shrinking, so the volume, cardiac output is decreasing. If you ever seen the movie, there's an old movie with Denzel Washington. It's called John Q. His son has hypertrophic cardiomyopathy. That's what the movie's about. He kind of goes off the rails to try and save his kid. Okay, good movie. I recommend it. It's older, but it's good. Rheumatic fever. So this is a post-strep throat. It's autoimmune, and what it does is it attacks the valves of the heart. These are the valves, and it creates these sterile growths on there. They can break off, they can cause, basically become emboli, and they cause stenosis, so like blood isn't flowing through there appropriately, murmurs, and then it increases risk of bacterial growth on there if there is bacteria in the bloodstream. So like for certain procedures, like something like going to the dentist or something, they sometimes need to pre-medicate them just in the event a little bacteria gets in while they're cleaning your teeth and prevent endocarditis. Aortic valve stenosis, we pretty much all develop this when we get older because it's just seeing such high pressure, so it's pretty normal like in your 60s or so to start developing it. But the problem here is, when you do develop it, is the blood can't flow out. So the left ventricle's stressed. And so if it's stressed, it starts to get thicker. The muscle is working out. There's your ventricular hypertrophy. Low blood pressure because cardiac output is low. Low pulse pressure because cardiac output is low. And then there's that systolic murmur we would hear as the left ventricle is trying to pump out. Mitral valve stenosis, this is another common one, and same thing, we're not going to drop as much blood into the heart, into the ventricles, and so cardiac output will be reduced. Okay? Pulmonary hypertension, because that's where the blood's returning from. It's a backup. And so the pressure increases, and pulmonary hypertension is a killer. Right? So it does need to be treated at times. Lowering blood pressure is important. And they do other medications like increase the plateau of the heart and make it more efficient, beta blockers. There's all kinds of different options there. All right, EKGs. If there's a really good book by Dubin, Rapid Interpretation of EKGs. I'm just looking over at the book. A great book if you really want to dive deeper into EKGs. It's a good book. Okay, so normal bradycardia. So that's a little slow, but the rate, or not the rate, the QRS and T look appropriate. PQRS and T. Okay? Atrial tachycardia. So this is like SVT. Superior ventricular tachycardia, and so this goes ultra fast. Okay? Basically, they have two AV nodes in the heart. Third degree block. So what's happening here is like P wave, QRST, P wave, big gap. That's not good. Okay, so they're dropping a beat here. You can see P wave, nothing. P wave, QRS, very bad. This is VFib. This is death. Okay, this is what happens like post MI. There is risk of it. Trauma to the chest. There was a football player not too long ago. He collapsed on the field after getting tackled. Like the helmet hit him in the chest, and the sternum just whacks the heart, and the heart goes, not gonna work anymore. Okay, goes into VFib and shuts off. And sometimes it just, like a light switch, can shut off. Okay, has to be restarted at that point. You see this also with like electrocutions. When people get heavily electrocuted, they go into VFib and pass away. Left and right heart failure. The big thing, you can see there's a massive heart. Left-sided failure versus right-sided failure. So the problem here, when we say right-sided failure, so right side means I'm not pumping to the lungs well, and it's backing up. Because it's backing up into the right ventricle. If it's backing up into the right ventricle, well, where's that blood coming from? That's systemic. So they'll have a systemic edema. Everywhere is swollen because the veins can't drain through that system. If it's left-sided heart failure, well, where's that blood coming from? So left atria, lungs, pulmonary hypertension. Okay? So remember, it's a drain from that side, not necessarily a pump forward. Okay? So here's another image for you guys. Okay? And the last thing here, this is DIC, disseminated intravascular coagulation. Okay? So whenever we get crazy disease and we trigger this system, we clot and then we bleed. We clot and we bleed. The problem is you start to obstruct tissue. So cardiac function decreases, heart failure, organ failures, okay? This is failure all around. So as the body shuts down, eventually we can go through multi-organ failure, or we get an infection and we trigger this system. We can see that as well.